16, Gracey Curets in quadrant 1, buckle. Determining the correct working end. Once again, fulcrum. Use the toe third, place it interproximal. Line the terminal shank up with the long axis of the tooth, and the handle comes out nicely. We're going to be working on tooth number 3. We'll start at the distal line angle. We'll walk across the buccal wall, and we'll end up in the mesial area here. So we'll start right about here. We want to close the face, so we have 0 to 40 insertion. We want to float subgingivally, and we're closing the handle as we do the assessment stroke, feeling our terrain. If we come across deposit, we're going to lock onto the toe third, lift, relax, lift, relax, lift, relax, lift, relax. We're going to float back up and feel how we did. We're going to assess again with a closed, handle closing assessment stroke, which is also how we do our biofilm deplaquing stroke. If we come across calculus again, we'll get under it, lift, relax, lift, relax, lift, relax, lift, relax. Assessing, lift, relax, lift. If you lift and nothing's happening, you relax the hand, close back down, you abort the mission. When you get to the mesial line angle, that ding 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 will go off. You'll turn just a little bit so you can get a very good angulation at the mesial. You're going to close your face, slide into the mesial, feel your terrain, lift, release, lift, lift, release, lift, release, lift, release. Feel your terrain, smooth, and slide back up. From the premolar, we'll start at the midline. Try to close our face as close to 0 insertion as possible. We're fulcruming on the lingual incisal cusp. We're going to slide subgingivally, float in, feel. Once we understand the terrain and the calculus, we're going to walk under it, lift, relax, feel, lift, relax, lift, relax. Moving as we go, assessing how we're doing. Feel more calculus, lift, relax, lift, relax, lift, relax, lift, relax. And the amount of lateral pressure, the amount of opening is all in direct relationship to the size of the calculus that we feel. If it's tiny little pieces, the lift is going to be very small. And you're not going to engage all that much lateral pressure. When you get to the interproximal, close the face, feel, lift, relax, lift, relax, lift, relax. And we know that most of the deposit happens or occurs interproximally, so I want to be very careful to feel and assess this thoroughly. Lift, relax, lift, relax, and then float back up. To utilize the Gracey Curets on the lingual of quadrant 2, we'll again determine the correct working end, line the terminal shank up, place the toe interproximal, make sure we have a fulcrum, and the handle comes out nicely of the mouth. So once we determine we have the correct working end, I'll go ahead and demonstrate on the distal of tooth number 14. We use our mirror to hold the tongue down, to kick up extra light. We'll start at the distal line angle, close our blade or our face as much as possible. 0 to 40, we slide subgingivally, assess our terrain, and we feel calculus. So we'll lock under the toe third, lift, relax, lift, relax, lift, relax, lift, relax. And I float in and I assess. I still feel a little bit, so I'm going to lock onto my toe third, lift, relax, lift, relax, lift, relax, all the way around to the distal. On the premolar, I'm going to start at the midline, close the face as much as possible, float in, assess, lift, relax, lift, opening, nothing's happening, so I abort the mission. I relax the hand, close, reinsert at a different angle, lift, again, close, lift, relax, lift, relax, lift, relax. And it's that little biting noise that you want to hear. Close, lift, all the way around to the actual distal. And if you're not feeling anything, again, it's just a biofilm disruption assessment stroke. To use the 15-16 in this area, you determine the correct working end by lining up your terminal shank. On the premolar, we'll start at the midline. We're going to close the face as much as possible. Start the get ready zone. Float subgingivally. Assess the area. Lock onto the toe third. Lift, release. Lift, release. Lift, release. Lift, release. Lift, lift, lift. Close and feel. It feels acceptable. You're going to just do your biofilm removal assessment and walk along. If you come across calculus again, you're going to lock onto your toe third. Lift, release. Lift, release. Making your way all the way around to the direct nasal. And finish up with your smoothing stroke. We'll utilize the 5-6 Gracie. To determine the correct working end on the 5-6 Gracie, we're going to be evaluating the face to tooth relationship. We'll line the handle up for parallelism so that the handle is parallel to the long axis of the tooth. We'll close the face down and we'll determine whether we have the back of the instrument, the back of the foot facing us. And here we have the back of the instrument facing us, which is what we want. On this end, we have the face of the foot, which we do not want to see. We want to see the back of the instrument, like so. I'm going to close the foot to 0 to 40 for insertion. I'm going to start the get ready zone. We're going to face our toe going somewhat apically, so that our handle is now at a diagonal upon insertion. We're going to float subgingivally. We're going to feel, if we feel calculus, we're going to lock onto the toe third. Lift, release. Lift, release. Lift, release. Lift, release. If we don't feel calculus, we'll just be doing a closing with the handle to do our biofilm disruption. Closing. There's the assessment of the biofilm disruption stroke. It's okay to change your fulcrum as you go around the anterior so that you have the best adaptation. We always change our fulcrum or move supra, not while we're sub. We're going float in, feel, lift, release, lift, release, lift, release. If we don't feel anything, close, slide out. Tooth number 9, close, float, lift, release. You don't want that long of a drag nose. Lift, release, lift, release, lift, release, making your way around, assessing biofilm disruption as you go. Again, if your patient just has plaque biofilm and you're determining that through a full mouth exploring, all you're doing is sliding in and disrupting or removing biofilm from the sulcus. There's no lateral pressure, there's no engagement, there's no locking, because there's no deposit to get under. But you're just moving through the sulcus, disrupting biofilm, and assessing your surface. Go all the way into proximal, closing upon entry, slightly closing your face down, lightly smoothing. On the lingual surface, you want to use your mirror, determine your correct face-to-tooth relationship again. Once you determine you have the correct working end, and that the face is hugging the tooth, you want to line up for parallelism, tip over diagonally for insertion, close your face, slide under, feel,